Hi everyone, Dr. Saurabh here. So today's quiz was on vision charts, and really speaking, I'm not happy because I expected every one of you should get 8 questions or above correct out of 10. So many have got that much, but I wanted everyone should get this much. So see the explanations on where are you making mistake, because 6 or 7 questions were previous year questions and topics. Now, many are perturbed on seeing this image because it doesn't look like any other chart. So, this is a variant that you can rule out the options also if you don't know. Teller's chart is having some gratings. One half is empty, hole in the center, and there is a gratings for vision testing in children. I hope everyone can rule out Ishihara chart. Landol's is C chart or E chart. So this is a variant of Snellen's in practical rooms. When it's on computer screen, you can have all the letters in one also. Plus, there is a computer screen in which you can change also. So ruling out this is nothing but Snellen's chart. And if you would have zoomed a little bit, you could have seen here written 6 by 18, 6 meters, 6 by 18. Doesn't matter if you don't read this, but ruling out the option will give you that this is Snellen's chart. Snellen's is based on form sense because the color and contrast of the letters are same, the size and shape is changing. That tells about the visual acuity. Now this is again for form sense but not Snellen's. This is early treatment of diabetic retinopathy study done from 4 meters, but it is based on logarithmic of MAR. That's why it is known as log MAR chart. Snellen's is based on MAR chart. It is based on form sense, done one, all the tests are done one eye at a time, yes, except near vision chart, which is next question. So B is the incorrect because it is based on log of MAR. Now this is near vision chart, which can be Snellen's, Jaggers, Romans, subjective, yes, but done both eye at a time. And of course, if the smaller letters are difficult to be read, it is an elderly patient because of presbyopia. The near vision is reducing. For vision testing in child, which is not used, tell us I told you, optokinetic drum and visual look response, which tells about the visual pathway. Now, Landol's is a subjective test. For children less than 1 year, you can ask them anything, they will not reply. So, for less than 1 year, you have to do objective test. The ABC option or objective test. Landol's is a subjective test. Sixth question is the Ishara chart. The Ishara chart is based on color sense. So the question was, which of the following is based on color sense except anemaloscope, Fanson Munsell, Edridge Lantern, or other color vision tests? Paley Robson is based on contrast sense. That's the answer of this question. And this is the Paley Robson on a computer screen. This is the contrast is decreasing. This is Paley Robson for contrast sense. A person can see top letter. Now you should not know all the letters, but you should know the top letter is corresponding to 6 by 60. Patient is standing at 6 meters. He can read that 6 by 60 means his visual acuity is 6 by 60. Normal person can see the letter from 60 meters. Now, of course, if he can see only the top letter, A option, he cannot see the rest of the letters. But if he stands at 60 meters, he will not be able to see only from 6 meters he able to see the top letter. How can I see the same letter from 60 meters? That is the incorrect statement. Now from 6 meters, the minimal angle of resolution, you have to just reverse. 60 by 6, you are good in maths, is 10 minutes. And to see if you want to see the 6 by 6 letter, of course, he has to come forward towards the chart. So B option is the incorrect statement over here. Now what is being done? It is a perception of light from one quadrant. Inferior quadrant I am throwing the light, and superior retina is checked, because retina is like a dome. If you throw the light from inferior, the superior part of retina is illuminated. This is projection of rays from the inferior quadrant to check the superior quadrant or superior segment of the retina. Total angle to calculate, only MAR is asked. Reverse the visual acuity, that is 3 minutes 18 by 6, but each segment is made up of, each letter is made up of 5 segments, and each segment can subtend minimal angle of resolution. Means the total letter is asked, you have to multiply the minimal angle of resolution by 5. So 3 into 5, 15 is the answer of this question. I don't think so any question of this is only the English. Sometimes English is also, basic English is also very, very important to solve questions, and one or two questions were based on English. Knowledge is there, yes, but to understand and interpret the question language is also very important, which you can learn as we go on in the quiz. Thanks again for listening. Best wishes.